The following segment is sponsored by Munson Healthcare.
October is Breast Cancer Awareness Month, and Munson Healthcare is offering a special mammography screening day. The idea is to stay proactive and increase awareness of getting screened. One breast cancer survivor I met with says she's made it her mission to encourage other women to stay ahead of cancer.
Be aware of it. Don't think it can't happen to you.
You could say life is like a dance for Debbie Weir, and she chooses to make the most of every step. She and her husband are avid ballroom dancers, and raising 7 kids surely kept them on their toes.
We do cross-country skiing and racing and everything, so we were always trying to eat, nutritionally sound and everything.
It wasn't until a couple of years ago, in May of 2016, Debbie's life suddenly changed.
I was thin most of my life, and then as I got older and I was going into my 50s and 60s, I started adding weight to myself, and I was trying really hard to lose that weight.
After losing close to 50 pounds, Debbie found a lump in her breast. Further tests showed she needed a mammogram, which would ultimately give her some insight.
I had my mammogram done, and that led me to an exploratory mammogram, a little more invasive mammogram, and that led to ultrasound. And there they told me that they had found something that had irregular edges and that needed to be biopsied and checked further. My answer was positive, which took me back. Sorry.
It's okay. It's okay.
And because I never imagined, even though you're being tested for all this and everything, you just never see yourself connected with that C word next to you.
With no family history of breast cancer, Debbie was learning all she could about a disease she was now facing.
For women, as you gain weight, the more weight you're carrying, the more estrogens you have in the body. So my cancer was invasive ductal carcinoma, which is an estrogen-dominant type of cancer.
In an effort to help women stay ahead of breast cancer and make time to get screened, Munson Healthcare is offering a special program at several of its hospitals.
So we're looking at women ages 40 to 75 that haven't been screened in the last 2 years. We're going to do a direct mail, and we're going to offer screenings on October 20th and just make it more convenient. But if that date doesn't work, you can schedule your appointment whenever is necessary.
Several hospitals within the system are taking part, especially because Northern Michigan has the highest incidence of breast cancer in the state.
The incidence is higher than the rest of the state, and we do not know at this point why. So we have some researchers here from Michigan State that we collaborate with, and that's we have a grant for that we're looking into maybe some of the causes.
For Debbie, her mammogram helped catch the cancer early. The cancer didn't travel past her glands, and she ended up going through surgery followed by radiation for 5 weeks. She's now at her 2-year mark with a healthy prognosis and a message for other women.
It's really my mission to help other women understand that you have to be proactive in checking yourself and getting your mammograms, thermography, but mammograms, if you have any serious issues.
And along her mission, she's continued to never miss a beat.
I never stopped dancing. My husband and me do ballroom dancing, and we danced all the way through. Never took a day off. Never took a week off from dancing.
The Munson Healthcare Mammography Screening Day is Saturday, October 20th, and you do need a referral from a primary care physician. If you have questions about scheduling, conflicts, or insurance issues, I've posted all the additional information, including the hospitals taking part, on our website, upnorthlive.com. For TV 7 and 4 News, I'm Melissa Smith.